Good evening and welcome back to Mystic Matters. We are the Greater Mystic Chamber of Commerce. Good evening, Tricia Walsh, and welcome back.
Thank you. Good evening, Suzette.
Well, what is happening now? Here we are right in the middle of fall, and I know the Chamber's got all kinds of things going on.
Well, you wore your appropriate costume.
I did.
For the timing.
I did.
It's kind of actually a nice time for the Chamber because we've just wrapped up our fall festival 2 weeks ago, and we're just in the planning stages and getting everything ready for our winter events, which happen basically starting the Saturday after Thanksgiving. So we kind of have a little bit of a lull in events, but we're in the process of about to launch brand new website, mysticchamber.org. You will see that in the next few days or weeks, depending on what kind of glitches we run into, and that is going to be really exciting for the Chamber.
But Tricia, this has been coming on a long time. This has been a process.
I have been working on this for over a year.
Yeah. Yeah,
and with the team and with the staff at Miranda Creative, who's been excellent, and the database conversion, it's no easy feat.
Right. So if you were to look at this database, what would be, in your mind, the biggest change? I mean, easier to maneuver, or?
What we had really wanted in a dream site was something that was really easy for our members to access and to do things like make payments online, register for events online, getting all of the actual physical paperwork out of the way creates such a smoother work environment in terms of bookkeeping and all of those things. So we've been making the shift with the website we have, but we're excited to be able to offer even more of that with the new website. It'll just be a cleaner, more up-to-date. I mean, we've had the same one since 2003, so it's basically a relic at this point.
Right, right. Well, I know you and the staff have been working very, very hard, and so congratulations to you. And also congratulations, Tricia had a birthday a couple days ago, and so another year older. It's not all that bad, Tricia Walsh, when you're 19 and a half. But anyways, congratulations.
Yes.
Well, Tricia, this past year has been sort of a journey for myself.
Yes.
Having been diagnosed with breast cancer, and of course, I call myself overcoming breast cancer. I don't like the survivor word, even though I know it's a word that we all use, but it's more than that. I think it's overcoming and surviving at the same time. But this sort of is an intro to our guest, and one of the first people, sort of, that I saw after all the doctors and family was Carol Ryle. And I want to welcome her back to Mystic Matters. And of course, we are celebrating October. This is Breast Cancer Month. And Carol is the owner of Pink Mermaid on Route 184 here in Groton, not far from here. And certainly a friend to the Chamber, a friend to the community, a friend to all the women that are celebrating, recovering, and surviving and overcoming breast cancer. And so, Carol, welcome back.
Thank you for having me back.
And you've got a lot of product here today, but tell us a little bit about your background and your journey to open up a retail store, Pink Mermaid.
Okay. Well, I had several years working for different medical equipment companies. I'm also like a brace fitter. I'm a BOC certified orthotic fitter. But my favorite part of my job at each place was working with the women that had had breast cancer surgery. And so I really wanted to just branch off and do that and have other things that medical equipment stores didn't really have, like, swimsuits and negligees, things to help them feel pretty again afterwards. And I didn't want white and black walls. I wanted pretty. So you'll see, we have pink and aqua.
Yes. And it's incredibly welcoming and warm, and it doesn't feel like a hospital when you walk in there, or any type of medical facility. It feels like you're walking into a nice shop where somebody is going to give you the attention that you need.
Oh, good. I'm glad it feels that way. We wanted it to have a boutique feeling.
But you also have a private room, having been there, that is sort of a one-on-one fitting for the women that are going through this type of reconstruction, and also it's tough with the drains. That you wear for weeks and weeks and weeks, and that's of course depending on the patient.
Yeah,
right?
they can be anywhere from 3 days to 3 weeks, but the drains are inconvenient. thing to deal with when you have everything else. You can't lift your arms, you're sore, you're worried, but then you have these drains, and that it's very inconvenient. So there's some things that can make the drains, living with the drains, a little easier. I'll show you one thing, which this is called a shower shirt. This is when you first come home from the hospital and you have the drains, many of the doctors tell you you cannot take a shower. So you know how bad you feel if you can't take a shower.
Right.
And that, I mean, you're already feeling bad, so you want to be able to wash your hair and take a shower. So this is a shower shirt you put on. It has fabric lining in here. You do it up really tight around the neck. It zips up, and then you can push the bottom of it up as high as you want. It has actual pockets to put the drains into, Velcro and a zipper. But it has actual pockets to put the drains into so they're not flopping around inside. You push the arms up, and then you're free to wash your hair, wash other parts of your body, and then you can just use a washcloth for the parts in here so you don't get your incision sites wet.
Right. I'm just going to hand that to Trish.
Yeah.
So Tricia, my sister actually bought this for me, unbeknownst to my. I didn't know this, but she went down to Pink Mermaid and actually bought this, and this was sort of a lifesaver for those of us who just could not live without a shower. So
Without a shower.
I highly recommend that.
Yeah, well, I'm glad it helped you.
Yeah, thank
it helps
you.
Most people. Actually, the person that invented it is a breast cancer survivor.
Yes, I know.
But she thought that was her major problem with after the surgery
Right.
was she could not stand not taking a shower, and doing the plastic bag thing just was not working for her. So she invented those, and they've been a hit. Been a very popular item. This is what we call a post-surgical camisole. This is often worn right after the surgery, and the reason it's designed the way it is, and it's so you can step in it and pull it right up. It's because you can't necessarily lift your arms up to put a bra on or move around that well. And this also has special pockets for the drains.
Right.
And this is usually worn, it can be worn anywhere for like 2 weeks to 6 weeks out. The pockets for the drains are Velcroed, so they come out when the drains go away. It has a little puff in it. It comes with 2 puffs in case you need 2 puffs. So you can still have a little shape in your shirt, over your bandages and everything. Some ladies, when they get past the point where the drains are gone, will actually trim it so it's more like a bra size. You can go into like the leisure bras a couple weeks after, but usually you don't go into a tight bra until 4 to 6 weeks after the surgery. So this is usually what's worn. This
That's
is
correct.
covered by insurance.
Oh, okay.
So that's nice.
So I guess that's a good question, huh? Are most things covered by insurance?
Some things are. The shower shirt is not.
Right.
Things considered medically necessary are covered by insurance.
This is very soft, so
It is soft and
Yeah.
stretchy. Yeah. And I tell ladies to try it on beforehand because you're not just fitting the top, you have to go over your hips.
Oh,
And
that's
so you have to
right,
make
yeah.
sure, because some people are a little wider in the hips, so you may need a little
Oh,
bit
good
larger
point.
size. But they're very
Okay.
stretchy. They go on easy. They're soft. They're not confining.
And would you sleep in something like this?
You could.
You
yes,
could?
yeah.
Okay.
Yep. Nowadays, we're seeing a lot more ladies are having lumpectomies or reconstruction, and sometimes the reconstruction is started the same day they do the mastectomy, on the
Right.
table. Sometimes they go home with what's called a compression bra, and this is what this looks like.
Yes, it's a wonderful equipment.
Your jokester's
This
coming
is
out.
this is actually what Carol sold me.
Yeah, these are not
Yeah.
comfortable.
Yeah.
But this is a softer fabric than another brand that is on the market. This one's very soft,
Right.
made by American Breast Care. But it has Velcro shoulders, and it gives good support. And it holds the little inserts in place,
Right.
so they don't move around or anything. You usually have to wear this for a while.
That's that it probably you're wearing that up to 2 to 3 months.
Yeah, and
After surgery.
once the expanders are enlarged enough where they go in and they put the real inserts in, sometimes they have to wear this strap across the chest.
Yes.
And it just kind of goes across like this
That's another-
and holds them in place.
Right.
So
This is not covered by insurance. That is
Yeah,
not
okay.
covered by
Yeah.
insurance. And they should be, but they're not.
Right.
So when you leave the hospital, you're not leaving with any of these things. You actually have to go right after your surgery and go shopping for these items that you need.
The plastic surgeon may give you something like that. He may give you a catalog and have you order it. You're not going home with any of this stuff unless you come into the store and get it beforehand. Yeah, typically don't go home. A lot of the ladies are coming over before the surgeries to see what it is they'll need, so it can get all lined up, because to get the insurance coverage, you have to call, we have to verify and all that stuff. So they or a family member can pick up the post-surgical camisole after they're discharged from the hospital, because the insurance will not let you get that until you've had the surgery. So you're not going to have it going into the hospital. So that's not going to, let me throw that over there too.
But I also think the other nice thing is too, if you don't go in ahead of time, is I think the one-on-one, Tricia, and she actually fits you there.
Yeah.
So I mean, to me, it would have been hard. I thought I wanted to go in there because knowing Carol and having been on the show, I thought I would want to go in there prior to the surgery. But I think you really need that one-on-one and someone to actually fit you, because these bras are not the same as your normal bra, and you are not the same. I mean, you come out totally different than what you went in with, whether it's the expander or whether it's reconstruction. It's not the same fit. So that's true, Carol, is one of the nicest things and the most enjoyable time with you. And then if you didn't have the size, she can order it for you as well.
Yeah. That's true. We can order many sizes, many colors.
Right.
Because everybody's tastes are different. I could never stock it all.
Right.
I need a Walmart size store.
Exactly.
So some of the forms that you would get, let's see, there's so many of them nowadays. This is just a puff form. It has fiberfill in it.
Okay.
Some ladies will get this for afterwards, and that's kind of what comes in the post-surgical camisole, just to have a little something there until they're healed enough to the point where they can go into something else. And they don't come in a lot of sizes, just like small, medium, and large. That's not covered by insurance. This is...
She knows everything.
This is a swim form. And used to be the swim forms were heavy silicone. You can still get those, but this one has little plastic beads. It is important to replace the weight after you have the surgery, because your shoulder muscles, back muscles have been used to holding the weight of the breast. And so when you remove one or remove both, if you don't replace that weight, your shoulders can curl.
Come in.
So this one does not replace that weight. This is just to use for exercising or swimming. You wouldn't want to wear this all the time. You really should have one with some weight. But you can see it's very lightweight.
So this can be put into a regular swimwear?
You could put it in regular swimwear, and you could pin it in, or it would probably stay in place okay, because it doesn't have the air in it, so it won't float out like these ones will. These will float out. Because they do have whipped air inside, they'll come out. So they need to be held securely in place.
Okay.
That's also good for yoga, or where people don't want to have a lot of weight on them, especially if they've had a double mastectomy. So most people that are going through the reconstruction process may want a form like this. It is silicone on the front, but the back is hollow. It has the stuff in it here, more fiberfill. So what happens is, in the beginning of the process where the breast is small, say they have one breast and they want to look equal, they're going to put this on and put a lot of the filling in it. And then as the breast gets larger, as the doctor inserts more of the fluid in here, they're going to pull this out. And sometimes once they're done with the reconstruction, they never need this again. But the reconstruction, it can take a few months. So this helps them look normal when they're going back to work. If someone hugs them, it feels soft. So this just gives them a sense of normalcy, and they feel and look beautiful again. Sometimes the nipple is not there, and so even though they might be a 36C, and this side may fit perfect, the other side's going to have some ruffling of the fabric because there's just not enough breast tissue in there. So they may keep wearing this, but with no stuffing in it. So you can see what that feels like. It's very soft.
And I did that for a while too, because obviously it's not the same, and you have some little sunken areas.
And that's common after the surgery.
It does have some weight to it.
It does. I saw Tricia, her look on her face going, okay.
I'm like, wow, it's amazing that you would, you would definitely miss this kind of weight on your whole body.
It's really, just getting back to that a little bit, Tricia, that is, actually, I never thought of that, that you would have the loss of it and sort of come forward, because you are so used to having those breasts. And that could be permanent. Well, not so much permanent, but you could get punched over and used to that.
That's very true. There are some ladies that, if they've had a bilateral mastectomy, they never liked wearing bras. They don't want to wear bras. And so they opt not to do that. And, But you can go to physical therapy, learn the exercises to keep your shoulders back, and they can move on without wearing a form.
Right.
It's probably more important when you have one missing, because you want to.
It's the balance.
You want to
need
get the balance. You need
Yeah.
the balance. Yeah.
You do need the balance.
So these are lumpectomy forms. They come in many sizes also. This is for anyone who's had a lumpectomy, whether it's a little bit on the side, the top, wherever. This kind of just evens it out. And that's a smaller one. This is kind of a medium-sized
This too,
one.
Tricia, is. Now, what is this made out of?
Silicone. This is silicone
So this is
also.
the actual silicone in.
Yeah, this is also, all these forms are covered by insurance.
So is this silicone is similar to the silicone if you had silicone breast implants?
Yes.
Yeah.
Huh.
Yeah, they
So-
actually
Yes,
kind
that's
of look
actually
like
what-
this. If
Yeah.
you've
They
ever seen one, they
look-
actually look like
yeah,
this.
they do.
Yeah.
Huh.
They look like that.
So those still fit in the pocket of the bra, so it would hold it in place.
This is silicone too.
Yeah, this is silicone too.
Yeah.
This, and you can feel that's a lightweight one. That is brand new. They just came out this month, and that's my first one. I have more at the end of this week. Feel this is the old lightweight that we've been dealing with for about 5 years.
wow.
What a difference, huh? That's called the Air Form, made by American
s-
Breast Care. Very lightweight.
So every few
They're like
years,
kind of like silly putty. Sorry.
right?
Yeah.
Yeah, they feel. But so every year there's something new that they're trying to make better.
Yeah, they're always trying to make. They came out with the massage forms, which are supposed to be cooler. I mean, the breast forms from 15 years ago were like, whoo, very heavy, you know.
Yeah.
And they still, you have to have the weight in there, so they can't be, you know. You can get a memory foam one, and that's good to wear, but not long term. A lot of ladies will get that right after surgery for about the first 6 months. But you want to replace some weight. It doesn't have to be as necessarily heavy as the breast itself was, because it's not it's not attached. And there were
Right.
attachable ones. Those are no longer covered by insurance. But it's held away from the body, even though it's in the bra. So it's exerting enough, weight and force on the shoulder to do what it needs to do. So I'll show you some bras.
I think this is just fantastic what you're doing here.
This is my #1 selling bra. It's made by American Breast Care. Nice. It gives good support. All of the bras have pockets in them to hold the forms.
Right.
And they just go right in the side. Oh, I have a string on that one. But they go right in the side. And I tell the ladies, you just lay it down, you fold it up, you put it in. Don't mess with it too much, because by the time you lift it up, it's going to slide around. Then we get the bra on and anchor it in place, and then we move it around. And we measure, make sure it's nice and even. But most of the bras come in many colors. This one comes in 5 colors. So that's just a basic insurance mastectomy bra. This is another one. This is kind of a seamless bra. That one has a seam on it. Some ladies do not like a seamed bra, and that has a
Right,
little fiber
right.
fill lining
I have this
where
one.
this one doesn't. This is a very popular one. It's almost like an exercise bra, and that
This
comes
is-
in
it
like
is
3
without-
colors.
Right. That was important to me, Tricia. I said, what colors do they come in?
No, this does feel very much like a sports bra.
Right.
So it lets
Yeah.
you breathe. And,
Right, right,
Yeah.
right.
This is a very special bra. This can be worn by anybody, not just a mastectomy patient. But this bra has a special design, and it has divided elastic here. I actually sell more of these to ladies that have had lung cancer surgery, because sometimes they'll have a cut here or back here, and so a normal bra hits them bad and hurts, so they won't wear it. So this is good for that. It's also good for somebody that's had an intercostal injury or any kind of rib injury, back surgery. It's got a wider side than most of them. It's very stretchy.
And so this is just not for mastectomy. This is,
Yeah,
anybody can
that
wear
does have
this.
mastectomy pockets, but actually I
Right.
sell more of those to people that have some other kind of chest
And it's
or back
actually pretty. It could
injury.
be used as like a
Yeah,
little camisole
Yeah, I was just
too.
gonna say, it
yeah,
looks
it's very
like a-
pretty.
It has a
Very
lot of
pretty.
fabric to it versus
Right.
some of the other ones. It's a little bit wider,
But it's pretty.
but that's so it can cover and it actually goes out too, so if they have a port in place,
Right,
that's
the
good
port.
for getting around the port, because some of the bra straps go straight up and hit the port, so you want one that goes around. So mastectomy bras are not just your grandma's bra.
I love it when
You
she
can
says
get
that.
these.
Yeah. That is.
And these come in black and pink and gray and white, all different colors with lace, or you can get them
Right,
plain
yeah.
without lace.
This is important.
That is
It is.
important.
So is something like this, though, one that would be when you're further along in the healing process?
That particular bra, because it goes very low, is better for somebody who's had like a lumpectomy.
Okay.
Because if you've had a full mastectomy, you don't have a lot of cleavage, and so you see that in that bra, and you may not want to see that. You can wear that once you're 6 weeks past surgery, usually.
Okay.
Yeah.
Right.
Some ladies that have had a mastectomy do wear it. They just, maybe you don't wear a shirt that would show the cleavage anyways. But then this is one that comes in 10 colors. You can get bright pink, but this is the #1 seller is amethyst. That's very pretty.
See,
And this comes in a lot of sizes. It goes up quite large.
I think this is important. I mean,
That's very
because if you want to still feel like a woman and a lady, I think the colors and the styles and just the lace is absolutely beautiful.
Yeah, and you can
Absolutely.
still dress for a holiday with a red one or whatever.
Right.
They have all
Right.
different types.
Right.
Then they have this
This is
one.
interesting. Is this a?
This is a strapless. I call it the wedding bra.
I've never seen that.
Look at the band in here. I mean, this is
Wow.
designed to hold 2 silicone forms in it well. So it will definitely hold your breast in place, and you won't be worried about, sliding down or coming out of place because it stays on really, really well.
I think that's
very
what
tight.
most women are scared of.
With a
That's
strapless
something-
bra.
Yeah, with the strapless bra. So.
And regardless of any type of surgery, that's
Right.
just the problem with
Well,
strapless.
anyway, you're right,
It's
Tricia.
like, this is
You're absolutely right. I probably could wear that for
anything.
just anything. Yeah.
And anybody can wear these bras. I have many ladies coming in, getting that particular bra anyways because they have a wedding to go to with a strapless and they want something with good support.
Right.
And
and
that's
and
one
not
of those.
finding the bra down here.
Yeah.
And
yeah.
now, does that come in different colors too?
Only 2, beige
Okay.
and black.
Oh, well, that's
Yeah,
all you need.
That's pretty
Yeah.
basic. And it does have clear straps, and it does have the black straps if you want to use them. They're detached.
Yep.
There's also this, there's this real pretty one. This is for somebody that has no cleavage, and but they still want to wear a little low-cut dress or top or something.
Oh, that has a
And this
built-in
is-
cami.
Yeah, this has a built-in little lace insert. It lays nice and flat on the chest, and that
that's
comes in
fantastic.
like white, candlelight, and black. That's a very, very popular bra.
Has its own little built-in little cami. That's
Yeah,
wonderful.
that's cute.
Yeah.
And this is, we have a special area in the store now for just cotton. This is a pure cotton bra, and it's not as fancy as the other ones, but it's well constructed.
Is
It
there
still
a
has the
call for
pockets.
these? For
Yeah,
this?
there's some people that
Okay,
can't
just
wear
wanna-
the polyesters
Okay.
and different things.
Well, especially you don't feel yourself anyway, so if they want something that's more natural and
Yeah,
more soft.
sometimes during radiation
Yeah.
they'll wear
just
a cotton
plain
bra.
Cotton bra. Okay,
We
well
have
that makes
a
sense.
full area where they have anybody that has to wear cotton fabric only. They can get the hats in cotton, the underwear in cotton. We have a little cotton area. This is one of the cotton hats, which are very cool in the summer. They're very, very comfortable.
Yeah, I can imagine that would be so. I mean, it'd be hot wearing some of the polyester ones for the
Yeah,
summertime, and if you want to wear
definitely.
even just to keep the sun off your head.
Yeah, because
You know.
I guess when
Right.
you're going through chemo, you can't go out
You can't go out
in the sun too much, so you need to cover your head. Some of the ladies, if they've had a few lymph glands taken out, or if they've had radiation, they can get what's called lymphedema. That is a swelling in the arm. Anybody can get lymphedema. Men can. Anyone that's had any type of cancer surgery or any surgery that's messed with the lymph glands, if they've
Right.
removed them or damaged them in any way, an accident can damage them, a motorcycle accident, anything can damage them. And then the lymphatic fluid is a protein-rich fluid, and it can build up anywhere in the body. And so they can do massage. The physical therapist will do a special massage to move it. But when they get your arm or whatever body part it is to the size that it needs to be, they'll maintain it with a sleeve. This is an arm sleeve.
Yeah, and this keeps that, sort of the swelling down a little
Yeah,
bit,
it helps
right?
to
And it's-
maintain it, yeah. That's one you
That's
would wear during the
fantastic.
daytime. That's from a company called Lymphedivus. They have really pretty colors. The basic one through insurance, of course, is beige. Those are a little more expensive, but you can get ones that look like tattooed arms. You
I
can
remember
get,
you
yeah.
bought one before. These are so fun.
They're beautiful. I mean, they have bright colors and flowers and butterflies and everything on them.
We only have a few more minutes, so I do want
Oh,
to get
okay.
to the bathing suits too.
Oh,
so-
okay. Well,
And
this
well,
is
this
the
is
one for
another different
nighttime.
one. Yeah,
That's
another different
that
one.
one you wear at night.
Yeah. Wow.
Okay.
Now, the silicone forms
Right, the
do have
forms.
air in them,
Yep.
so you have to have a pocketed swimsuit to keep them in. So this is a mastectomy one-piece swimsuit.
What a great,
Very
great, great
pretty.
colors in this. Look
Yeah,
at this.
very pretty.
This is fantastic.
It's
really.
ready to go back to
Yeah.
And a lot of the ladies will get a two-piece.
Right. So a little, maybe
because
a
if
little
you have the
bikini
form
top.
in there
Right.
and you go to the restroom, you take your top down, then your forms drop, you know.
Oh, okay.
So they'll just get like the shorts or the little skirt that goes with it. But there's all different kinds of top styles. Most of them come up a little higher and have adjustable straps, so you can adjust them. And then this is a little cami top for the summer. You can put the forms in there too. We have negligees too you can do that with.
And then you have this one last piece here.
yeah.
This is, I want to get that in before.
This is
we
a
wrap it up.
compression sock. If somebody needs compression stockings for varicose veins,
Right.
And they can't get them on, a lot of people can't get them past the ankle part, which is really tight,
Yeah.
and they can't bend over. This is a wraparound. This is made by Circade, and it just wraps around. You put it on like that. They're done by measuring, so we have to measure them to get their size. But then you put the 4 Velcro straps on, and what you do is to get your 20-30 compression, you see this line and this line, you just match it up with these 2 lines and you pull it till it matches. You start at the bottom and work your way up.
Is
and
this
that
something
gives
new?
you No, not really. It's
Okay.
just not real commonly used, but
Right.
it is great for somebody that can't get a stocking on themselves.
Okay.
This works real well.
Wow. Well,
Unbelievable.
yes, and I think it's really worth noting that. I mean, obviously, you really focus on the mastectomy products and all of
Yeah.
the anything to do with the breast cancer, but you also do have a large selection of items for other purposes
Right.
that are
Yeah.
still covered by insurance, and that people can visit you and they might only think bras or lingerie. So
Yeah, we do a lot of stockings.
yeah.
Yeah.
So I think that it's necessary to come on and really talk about everything. Now, one question I just have for you is, if you do get a bra, are you supposed to wear the same one time over time, or are we supposed to?
You can get different bras. Like if
Okay.
say your prescription says 3 bras, you can get one of the exercise ones, a regular one, a cami, whatever you want. No. They do, some doctors say you're not supposed to wear an underwire, other doctors say it's totally fine, but you will find in the mastectomy bras when you go to order them, probably each company makes one underwire bra because it's not a real popular style.
Right.
But pretty much everything else you can find, in a mastectomy bra that you could find in a regular bra.
Excellent.
Well, Carol, we only have a few more minutes left, and I just want to a personal note. Carol is one of the most compassionate people.
Thank you,
She's
Suzanne.
very well trained. I've been there. I've been in her little boutique area, in her little room there. So I encourage you, if there's someone you know or you're going through something like breast cancer, even if you have a couple of questions, just stop in the store and give her a call, because she's so accommodating. And so just
Thank
tell
you.
us where you're located, and we'll wrap up the show.
Okay, yep, we're at 1313 Gold Star Highway, which is Route 184. We're right next door to the Chelsea Groton Bank that's there.
Can't miss her.
Yep.
Well, Carol, it's always nice
Well,
to
thank
see
you.
you. You
Well,
know
thank
I'm going to
you.
be seeing you again.
Yeah.
Tricia, always nice to see you, and I'll see you next week.
Absolutely.
Okay, we are Mystic Matters, the Greater Mystic Chamber of Commerce. Good evening.